welcome back. A recent CDC survey indicates that mental health among teen girls show signs of improvement with a 6% decrease in persistent sadness since the pandemic. While these numbers reflect progress, healthcare professionals highlight that persistent sadness remains alarmingly high. To explore the steps needed to further improve mental health for teen girls, I'm joined by Andrea Cimino, Supervisor at JCCA's Westchester Day Treatment. Drea, thank you so much for joining me.
Hi, of course. Thank you for having me.
Now, can you tell me a little bit more about JCCA and, your overall work that you do at this organization?
Yeah, absolutely. So JCCA is one of the oldest New York child welfare organizations. They've actually been around for just over 200 years, which is really incredible. The specific program that I work at is the Westchester Day Treatment Program. We are located in Hawthorne, New York, but we do not only provide services to clients in Westchester, we provide services to students from all over downstate New York, from the 5 boroughs to Westchester, Dutchess, Putnam, Orange, all around. We provide individual therapy, group therapy, family therapy, and medication management for students ages 5 to 21.
Now, what were your thoughts when you probably saw the survey by the CDC that showed there was a 6% decrease in persistent sadness among teen girls?
Yeah, so I had a couple of thoughts on that. Unfortunately, my first thought was I wonder about the data and how much is being reported, or rather underreported, because this isn't, masking is definitely a real thing, and depression isn't always something that people feel comfortable talking about. On the other hand, on the flip side, I also feel that there's been a greater increase of mental health awareness, especially following the pandemic. So I'm also wondering if that increase and awareness and discussion has led to this potential decrease. So I'm really hoping that that is the case.
Same here. And I also, during the pandemic, I spoke to a lot of healthcare professionals, and people said that kind of being indoors for that long period of time can, lead to people feeling this sense of persistent sadness. And I wondered, kind of like yourself, now that people are out again and we have our support systems that may not only be confined to, our household, if that could have also contributed. So I thought that was really interesting. And I'm really excited to kind of explore a little bit more on what we can do to help teen girls and mental health. Now, with that being said, although this does look like we're making some progress, although it went down a little bit, the rates are still very high, which is alarming. Can you tell us a little bit more about some of the challenges that teen girls continue to face?
Yeah, absolutely. As the challenges evolve, teen girls also evolve. And I think social media has such a big part to play. It's ever moving, always constant, always present in our lives. And I think, comparison can be the theft of joy, and it's so easy to compare to what we're seeing on the screen without realizing that these are snippets of people's lives. Not only that, they can also be highly edited. So what we're seeing may not be what is real, but as a teenager, you may not be able to know that just yet. And it can be so easy to experience your own insecurities when looking at a picture perfect version of what you want to be.
Now, as you mentioned, teen girls evolve. So how does the organization kind of adapt to the changing needs of, our young people today?
Yeah, absolutely. I think the fact that JCCA is 200 years old reflects that we have had to evolve. We wouldn't be around this long if we didn't. So I think, we've opened a lot of programs. We actually just opened a Youth Act program in the Bronx. So we're providing services in different areas throughout New York. And I think that expansion and allowing teen girls to have access to services is definitely a big key piece in this.
Now, something I definitely want to mention is, and I feel like you're kind of touching on it a little bit, is that girls from different socioeconomic backgrounds are going to have different experiences with, anxiety, depression, and all these other mental health challenges. Can you, talk a little bit more about what you've seen in regards to how this affects girls from different backgrounds?
Absolutely. Yeah, socioeconomic status is something that maybe consciously teenage girls aren't thinking about, but it is something that affects them. If you are from a higher socioeconomic status, then you have the privilege of not having to worry about where your next meal is coming from, not having to worry about if your parents are paying the bills. Whereas if you are from a lower socioeconomic status, you may be hearing these conversations constantly between your parents, your guardians. Also, you may need to support with childcare or yourself getting a job, figuring out where your next meal is going to come from. It's a number of factors that while we don't necessarily think about day to day, there are certain people who have to think about it day to day. And of course, it's going to impact their overall health.
Now, how does the JCCA support teenage girls who may be struggling with mental health issues but lack the adequate resources to kind of address them?
Yeah, so JCCA can support by providing clients with access to these resources. With the day treatment program, for example, clients don't need to go out after school, set their own therapy appointment, transport to that appointment. Everything is done right in school. So if they feel like missing art for one day, or if they're like, you know what, I really don't want to go to gym today, I'm going to therapy at this time instead. It removes the barrier of transportation, makes it more accessible. We're right in the school building. Other JCCA services will come right to your home. So transportation is not even a factor in that.
Now, with that being said, talking about school, so many children, of course, are in school. What responsibility do you think these institutions have to kind of just address mental health that are facing their students? Because there's so many things happening, especially in lower income neighborhoods, where these schools have to kind of focus on making sure these students are kind of set up or prepared for college and that next step in their education. What responsibility do you think they may have in regard to mental health?
Yeah, I think that is such a good question. I think with schools specifically, the focus needs to be on allowing all students to access mental health services, not just highlighting this student may have depression, but rather destigmatizing it, making it a fully normal experience, encouraging everyone to go to therapy. Because you may have some students who feel discouraged because they don't want a stigma of having to go to therapy. Likewise, you may have some students who the teachers or staff would never know are experiencing mental health because they're high functioning. So I think normalizing it and giving everyone that access is going to be the way to go here for sure.
And then with that being said, I'm curious, do you think this should also be like maybe a lesson in health class? Like, should there be classes regarding mental health?
Oh, absolutely. Mental health is definitely health. And, the brain is an organ just as much as the heart, the stomach, the liver. It is absolutely a factor that affects our daily life.
That's amazing. Yeah, I was like, thinking back, I'm like, I don't know if I, had this in my health classes. Like, I don't think we ever talked about mental health at all.
No. Even just thinking back in past decades, even as a millennial, you see the difference now in today's day and age, for sure. It's much more talked about, and I hope it continues to be that way.
Now, can you tell us a little bit more about the role you believe community resources and, just overall support networks play in addressing mental health issues among teenage girls? So maybe outside of the school, but just different organizations within the area.
Yeah, absolutely. Within community resources, right? Not only could teenage girls maybe access, if they access different community resources, they may also connect to other teenage girls that have experienced similar struggles. It can be quite validating. You're not alone. And look, other people are going through this. These people are coming here for support. It's helping them. Maybe it can help me. So really expanding their connections as well, and also highlighting that they are not alone. They're not the only ones that are going through this. I think community resources have such an important role in this factor.
Now, I want to take a moment to also highlight members of the LGBTQ plus community. I understand that there are higher rates of persistent sadness within this community.
Yes.
How is JCCA addressing the unique needs of LGBTQ plus teens?
Yeah, so with JCCA, I am actually the co-chair of the JCCA Pride Committee. So we focus on providing special support for LGBTQIA individuals. We recently did a huge Pride parade on the main campus. And additionally, we also connect our students with different resources, some near the residential, some in the community and the city, but different locations where they can receive services. Because of course, when you are an LGBTQIA individual, you do have additional stressors, additional factors. A heterosexual cis student may not worry about having a roof over their head if they're in a quote unquote normal family. But as an LGBTQ person, you always have to worry about, is my family going to accept me? If they don't accept me, what could happen? Could my peers out me? What happens if school doesn't accept me? There's a whole bunch of questions that enter the picture, enter the chat, so to speak, compared to their straight counterparts.
Now, looking forward, what are some areas where you think more research or resources are needed to further improve mental health outcomes for teen girls?
Yeah, so I believe that focusing on trauma, specifically in teen girls, is going to be the way to go here. Depression is not one size fits all, and a lot of times these feelings of persistent sadness can actually be trauma symptoms. A lot of the behaviors that we're seeing in teenage girls could stem from trauma. And, I was just reading a survey from the National Institute of Health. They actually said that adolescent girls have an 8% chance of having PTSD compared to adolescent boys who only have a 2.3% chance. So, addressing trauma in these young girls is really going to be, I think, where the research needs to focus in order to improve quality of life and reduce symptoms.
And just moving forward, talking about stigma, I know that we are moving forward as a society, but certain communities, especially in communities of color, maybe people still struggle with the idea or coming to terms with just mental health in general. What do you think we can do as a society to kind of combat that?
Yeah, again, just normalizing. I think just talking about it, saying that it's something that everyone could benefit from. You don't just need a therapist because you are dealing with XYZ, or it's not only a certain type of people that could benefit from therapy, but rather making it an accessible platform to all, and that everyone can benefit just from being able to talk about their feelings or to gain coping skills to help manage frustrations of life.
Now, we talked a lot about the teen girls, but I'm curious, do
Yeah.
you have any advice for parents who may, want to be an ally or want to support their kids, but not really sure how to do so?
Yeah, I think that's such a good question. And I think ultimately just having an open conversation, being able to sit and listen to your teen without any judgment and without any thoughts of reflecting on yourself, on your own parenting. Because, if your kid is experiencing depression, that doesn't mean you're a bad parent at all. That just means your kid is a person who has mental health. We all have mental health. So I think just allowing those conversations to happen without any judgment is really going to be key.
That's amazing. And I'm so glad that we were able to have this conversation because it's something that I'm learning more about. And I think we all have a role to protect, the youth in our communities. So I think that's amazing. Very quickly, can you just let our viewers know how they can learn more about JCCA and all the resources that your organization provides?
Yeah, absolutely. So our website is jccany.org. Our socials are jccany. You can find us on Instagram, LinkedIn, on X. And I would encourage people, if you have any questions about mental health, go to our website, reach out, see what services can be provided, see how we can connect you with services, because I truly think everyone can benefit from therapy, and I'd love to support anyone who's interested in taking that next step.
Well, Drea, I want to thank you so much for joining us and really having this really meaningful discussion.
Yeah, thank you for having me. Thank you so much.
To learn more about the work this organization does and to get more information on their services, please visit their website at jccany.org. We have to take a quick break. We'll be back with more Open right after this.